Mayo Regional Hospital is a nonprofit acute care hospital located near the geographic center of Maine in the classic New England village of Dover-Foxcroft, the county seat of Piscataquis County. Set amid a landscape of mountains, lakes, and boundless forest, Piscataquis County is larger than the state of Connecticut. Our region features the best of small-town living right next door to world-class outdoor recreation attractions, Baxter State Park, the Appalachian Trail, the Allagash Wilderness Waterway, and Moosehead Lake. While Dover-Foxcroft is on the edge of the Northeast's largest wilderness, it is also only a 45-minute drive from the city of Bangor and an easy day trip to the rock-bound Maine coast. And at Mayo, the quality of healthcare matches Maine's quality of life.
I'm very proud to be associated with Mayo Regional Hospital and living and working in what I think is just a wonderful area. We really have, I believe, a gem in the North Woods that combines excellent opportunities for the practice of medicine with quality lifestyle. This is a four-season area that isn't for everyone. We're very rural. We have about 18,000 people in this county of ours that is 3 times the size of the state of Rhode Island. But if you like the outdoors, a four-season series of opportunities in an area where community still means something. There's a sense of community here in Maine in general and in Dover-Foxcroft that has been lost, I believe, in many other parts of the country. And you want to combine that with a challenging practice of medicine. This is a great opportunity and one that we seem to, those of us who seem to have landed here, oftentimes feel it's our best kept secret. In my mind, after 20-some years of administration in healthcare, one of the critical challenges and absolute necessities is to have strong working relationships with the medical staff. And we're able to do that very well here. We see the future together. I think that's part of the reality of living in a small community where your physicians are your neighbors just like everyone else in the community. There is a sense of community. There's a sense of mutual interdependence. So we work together. Our physicians are involved in all the key board committees, very heavily involved in our planning process with direct representation on our planning committee. And we tend to also, in the medical staff committees, have strong representation from the hospital so that we're really talking together and looking at clinical issues, looking at improving quality together. In a way that is very different than a lot of the other medical communities that you see not only in the state of Maine but around the country as well.
I'm very pleased to be a part of the Mayo Regional Hospital family. The medical staff here has a very strong working relationship with the administration and the board. Major decisions that the hospital is making about its future and its current operations are always made with the input of the medical staff members. Maine's a wonderful state. I like it professionally because although it's a large area geographically, it's a relatively small community medically. There are about 4,000 physicians in the state of Maine. I had done my residency down in Portland and spent some time away from the state with a military commitment before I moved back. I still know a large number of the specialists to whom I'd refer patients in the greater Portland area on a first-name basis. I know several of the people who are on the Board of Registration in Medicine, having worked with them in the past. Some of them are my classmates from medical school. It's a big state geographically, but a small state politically. You can get to know people, your voice can be heard quite readily. It's also a state that hasn't layered a significant amount of regulation on physician practices. When I was looking to leave the Air Force, I looked at opportunities in New York State, but found as I looked at those that the state has so many regulations that affect physicians that are in response to particular unique circumstances that have occurred perhaps in teaching programs in New York City that really are not at all germane to practice in rural New York, yet have become codified in law there. That doesn't happen in Maine. We've got a very effective medical association. Over half the physicians in the state choose to belong to the Maine Medical Association. They do a good job of representing those physicians.
One of the things that's important, I think, in taking a look at the practice of medicine in a rural area like ours is that you can't be all things to all medical situations. And I think we've done a nice job differentiating what's appropriate for our setting. We have a strong primary care base. We also have a representation of some specialty services, orthopedics, ophthalmology, OBGYN, that are nicely supported in this area on the one hand. On the other hand, some of the other specialties that require a larger population base to support, we rotate in on a clinic basis, which meets the needs of the community as well. Patients are able to access care in a clinic setting on a periodic basis during the course of the month, which is responsive to our local needs. Patients don't have to travel long distances to access care. The hospital has done a nice job over the years responding to the needs of the community. We tend to be very much of a family-centered facility that's committed to not only meeting the acute care needs of the region, but also committed to improving the overall health status of the region. The challenge for any hospital, and I think it's at times a daunting challenge in a rural setting, is to make sure that you meet the needs of the community. We've done that in a couple of ways. First of all, we have a history of working very closely with our physicians to try to plan appropriately for the future. In very recent times, we've completed a major facility renovation in which we've invested over $8 million in facilities. That's only part of the story. I think that the blend of the capability from a professional point of view with excellent facilities, and then the human side of medicine that we offer, the personal touches that are offered in a small setting, really help us differentiate ourselves from other settings and meet the needs of the communities very nicely.
I'm a family physician, so I not only will see the adults, but I'll see the kids, I'll see the grandparents, I'll deliver the children. I delivered the great-great-granddaughter for one of my patients a few weeks ago, and that's kind of a special thing that happens here in a small town. The school system here in Dover is fairly small, but they do a very good job with the resources they have. They've got a number of educators that are very committed to what they're doing. Their administration is forward-looking and planning to work with the state. Our school district was one of the first in the state to fully implement the Maine learning results, which is a state series of guidelines for education parameters. The high school in town is actually a private school called Foxcroft Academy. Foxcroft Academy has its own board of directors and has been providing education to the students in this area since about 1825. Maine's a wonderful place to live and to raise a family. There's so many opportunities here. There are museums, there are theaters. We're only 45 miles from the University of Maine, the flagship campus for the University of Maine system. The Maine Center for the Arts is over there. There are Broadway shows that come through several times a year on tour, many different types of musical activities. We're about an hour and a half from the coast. You could go down there and go sailing and do all sorts of saltwater activities, and yet we don't have to pay coastal real estate prices, which are considerably higher than those here in the Maine Highlands. There are so many things to do in this area. Hiking, there are about a dozen different day hikes that you can do with your children in the local mountains and hills. There are wonderful activities that you can do in lakes, rivers, for different aquatic sports. And Maine's a great place to live.
Looking for a more satisfying professional lifestyle with a true sense of community? Look no further than Mayo Regional Hospital.